Welcome to the Health Update. I'm Madison Kasper. Here with me is Dr. Aarti Raja, Mako Media's Health Adviser. Welcome, Dr. Raja.
It's a pleasure to be here, Madison. Thank you.
Our topic today is the spread of influenza. Dr. Raja, what is influenza?
So influenza is a virus that causes a respiratory disease. And it's a virus that seems to be present pretty much throughout the world. And in the United States, we seem to deal with this virus or infections caused by the virus usually around this time of the year. The fall pretty much is when the virus kind of makes its rounds in the population.
So what are the symptoms and how do they differ from common cold symptoms?
Sure, that's a good question. So usually any of these respiratory viral infections tend to have very similar looking symptoms. Just like you mentioned, it can be a lot like the common cold. But the issue with influenza is it can look a lot like the common cold, but then it's also, the individual will also have a lot of cough, cold, runny nose, sore throat, all the whole usual stuff. Along with that, unfortunately, if someone is immunocompromised, they don't have a very strong immune system, then influenza can be a lot more problematic, wherein the virus can cause an infection in the lungs. And if that happens, then the situation becomes more serious for the patient or the individual.
So how can students, especially those that live on campus and in dorms, prevent getting the flu?
Sure. The basic way to just prevent getting the flu is to get vaccinated against the flu virus. And we're lucky, we have good vaccines designed against influenza. So ideally, if everyone just gets vaccinated, that's the best form of protection against getting an infection. Short of that, if you didn't get vaccinated, then you are going to hopefully try to keep yourself distant, but not obviously that's a difficult thing to do, but protect yourself, not be in very crowded situations, or if you know someone who is sick or they're unsure whether they have the common cold or the flu, you might want to stay away from that scenario or setting so that you don't inadvertently catch the virus.
So how should students handle academics and responsibilities if they do contract the flu?
So if a student does end up with getting the flu or an infection, they should take care of themselves first. What they can always do is go to the University Health Center and also go speak to the Office of Student Disability and let them know that they have seen a doctor and they're suffering from this infection. And usually all faculty members get a notice from the Office of Student Disability that says, please excuse the student, they had this infection. And that, at least that way, that gives the student the opportunity to get better first and then go back and make up all the work that they may have missed.
Now, are there any treatments for influenza?
Absolutely. So preventive measure is, of course, getting the vaccine, and we at NSU offer the vaccine. So the NSU's pharmacy has vaccinations available to all faculty, students, staff, everyone. Anyone can just go into the clinic and you can get the vaccine. And they are available right now. If you don't get the vaccine and you unfortunately end up getting influenza, then yes, influenza does have treatments available. There are good treatments available, so they're referred to as an antiviral agent, but you'd have to go see a physician and they can prescribe that for you to help you recover faster than if you just didn't take anything.
Do you have any last thoughts?
My last thoughts would be, ideally, just get the vaccine. That way you can protect yourself and prevent even getting the flu.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.